Well, thank you so much. It's a thrill to be presenting at this year's Texas MPN Summit. And I've been given the topic of discussing ruxolitinib in the year 2022. And that's fantastic. I love that topic because it's really easy to present because there's just so much to talk about. Actually, that was the challenge, was squeezing all the discussion into a 15-minute presentation. So ruxolitinib was approved in the United States in 2011 for the treatment of myelofibrosis, which certainly was a watershed moment in the field of MPNs. You know, the idea that there was a singular pathway was brought up by Dr. Demonschek back in 1951, and then in 2004/2005 we found recurrent mutations in JAK2 mutations, in the JAK2 gene, which ultimately propelled the development of JAK inhibitors forward. JAK inhibitors were known and being worked on before that, but really that was kind of the big push there to really change the field. And the way it has changed the field, the advent of ruxolitinib, that is it's improved patient outcomes by a large margin. Not only does ruxolitinib shrink spleens and improve symptom burdens, as a result of the introduction of ruxolitinib, people are living longer. Now, there was, of course, the analysis of the COMFORT studies, which did show some survival advantage over best available therapy and placebo. But also, if you look at just the survival of patients diagnosed with myelofibrosis before 2011 and after 2011, the survival improved by a large margin as well, even in patients who are not getting ruxolitinib, which tells you that identification of JAK2 mutations and JAK-STAT activation and the development of JAK inhibitors not only help the patients getting those medications, but it's helped the field in general. It's helped put focus on the diseases and help us learn additional things to take care of these patients and other treatments that might be making people live better and live longer, which I think is the important point.